We're visiting the Nowshera Children's Hospital, which is a partnership between Hashoo Foundation and the Pakistan Pediatric Association and UNICEF. Hashoo Foundation is providing medicines as part of their partnership and a doctor to provide pediatric care to the children.
Well, I said I'm Professor Minjan in the Department of Pediatric Khyber Pakhtunkhwa Hospital, and I'm a General Secretary of the Pakistan Pediatric Association. We represent Pakistan Pediatric Association here, having 20-bedded unit consisting of 10 beds DTC and General Pediatric ward. We wanted to have another 20-bedded unit as well, but because of the limitation of the place, we could not get that. UNICEF is our major sponsor, has been working with us since a long time. Hashoo has been introduced by Dr. Zahoor, and we welcome that, and it's a bit more easy sort of a way to get things for the children.
We worked in earthquake.
Yeah, we did a lot of work in the earthquake in Balakot. We had a full-fledged hospital, and we were working there for 1 year. And we wish that we continue the same activity, because we have one after another disaster. Like we had the earthquake, we had the flood, we had the conflicts. So practically saying, if you go to the Tank and Dekhan and Sawat, you don't have the infrastructure, and the structure to be made through the government organization would be a bit more difficult, and we jump in and we take over the responsibility in consultation with the government. Here in Nowshera, we see 150 to 200 children a day. And these children pour in when they start seeing some help, or doctors and medicine and all that. Even today, our OPD was 115. 114 today, and we will be seeing another 15 in the evening. We would have another 10-15 admissions. To cover up all these children, the resources are still feel are meager, because see, if you cost one patient even $1 a day, 80 rupees, so even that you multiply how much it comes to be. And we don't have medicinal support from UNICEF. They give a lot of human resource, transportation, the equipment, etc. So that is our probably limitation, where we would need more sort of support from Hashoo or from any friend of children. I can call them.
We are open.
Anything else you would like to ask me?
Yes, to keep and sustain this unit, what are your funding needs?
Well, if we sustain this one unit for a year, it will be difficult to me exactly, but should be, I would say 10 million. About 10 million.
About 1 year.
Yeah, Pak rupees. It would be 10,000 something like
It's $12,000.
$12,000, but at least 10 million if we include the human resource, because we have 4 doctors around the clock, we have 3 or 4 nurses, we have dispensers, so each of them, the pay would cost Nawaz almost 400,000 per month. Yeah, and then the medicinal, and now I've seen a few patients, but we do that, we don't have oxygen here. No, only oxygen would cost me 10,000 rupees a month. But I do, I would have to shift this patient to the unit in the Khyber teaching, and these are things we can do very easily here. A consultant comes in, it's only at 45-minute distance. One consultant will spare itself of this pediatric association and can see these cases right there and can manage these cases right there. But in this hospital, you will be astonished to know that in this winter, you don't have oxygen. We have one cylinder, and that's when we have to go and we have to fill it back. So unfortunately, a lot of money is pouring probably here and there, but what is going to reach really the children and the patient, that depends who is there.
Conditions are the most common conditions that you see on the daily basis.
Well, mostly we would see diarrhea. 50% plus minus would be diarrhea cases and dehydration cases. Another 25% would be ARI cases. And then you can add another 5 to 10% to malaria season. So would be malaria and typhoid and other infectious cases. And then 5 to 10% cases would be like the one which needs further management, like hepatitis and heart diseases and complicated cases. These are the cases which we again refer them to have a teaching, other teaching hospitals.
Okay.